Okay, good afternoon, everyone. My name is Jim Clark and I'm the CEO of Oxfam Ireland. And you're all very welcome to this live event to formally launch the People's Vaccine Alliance Ireland. We're a coalition of human rights, humanitarian and development organisations, health practitioners, trade unions and activists who have come together over these past few months to call on the Irish government to address the current global vaccine inequity crisis, in line with the global movement for a people's vaccine. We're all acutely aware of the extraordinary scientific effort, heavily supported by public funding, that brought a number of vaccines into being in the shortest time in history, and the impact they're having here at home. We also know that in many parts of the world, it will take years before populations are vaccinated. This is a global health inequality that is simply not acceptable. This campaign is in essence quite simple. We believe that the answer to vaccine inequity in the world is to produce more vaccines, to increase the size of the pie rather than competing over a pie that is too small for everyone. We believe that the fastest, fairest, and most cost-effective way for doing this is to ensure that the technical know-how currently retained by a small group of global pharma companies is shared free from patents with the many companies across the world who are ready and willing to produce vaccines. Ireland has a very strong and deserved reputation of supporting human rights and showing solidarity with the world's poorest people. It's a cornerstone of our international identity and now our membership of the UN Security Council. However, Ireland remains one of the few countries that doesn't support the TRIPS waiver at the WTO. As COVID continues to devastate countries, exacerbating existing inequalities and reversing hard-won progress in fighting poverty, we reiterate our request to the Irish government to meet with civil society to discuss their current position, which is blocking progress in relation to the TRIPS waiver at the WTO. We call on them to join the growing number of countries supporting vaccine equity. Ireland must stay on the side of the people, learn from the lessons of the past, and avoid needless loss, suffering, and harm. As our own President, Michael D. Higgins, has said, solidarity in an interdependent world must mean standing shoulder to shoulder with those in other countries, especially poor nations with fewer financial resources, so that, for example, vaccines are made available, accessible, and affordable for all. We're so grateful and fortunate today to be joined by a wonderful panel of international and Irish speakers who will share their perspective on the campaign and how it can be a success. It's great to know that we have over 650 people sign up for today's event, and we hope that many more will be watching the recordings. Our campaign went live last week and sign-ups to our petition are growing at pace. On that note, if you haven't already done so, please sign our petition and share it widely. Just some quick housekeeping then before we start. A recording of this webinar will be available on the website peoplesvaccine.ie and on the YouTube channels shown in the chat box. Live streaming is also available if you'd like to share that link with others who might be interested, also in the chat. And if you have any questions during the webinar, please use the Q&A feature at the bottom of the screen. For now, I leave you with my co-host, Nadine Farris-France, Executive Director with the Irish Global Health Network. Welcome, everyone.
Thank you, Jim. And again, welcome to everyone. It's a very, very proud moment for me personally to be here and for all of us to be together celebrating the launch of this campaign today. I'm absolutely delighted to introduce our panelists. But before I do that, I want to reiterate what Jim's invitation and ask everybody who's participating today to sign on to the petition, www.peoplesvaccine.ie, and share. There's no better time to sign on than in this moment. We have very high ambitions for this campaign, and we really want to show solidarity on this issue, particularly for our colleagues and friends in the Global South. I'd also like to highlight the 19 organisations that currently make up the Vaccine Alliance Ireland. If your organisation wants to join the Alliance, you're most welcome. The email is there in the chat, as are the 19 organisations. So without any further delay, let me introduce our speakers for today. What an incredible panel. We have Mustaqeem de Gama, South African Permanent Mission to the World Trade Organization in relation to the TRIPS waiver. We will be hearing from Maho Rivas, an advocate for vaccine equity living in Cork. We will hear from Isabel Simpson, Executive Director of MSF Ireland. From Dr. Ciara Conlan, she's a doctor and co-founder of Access to Medicines Ireland. From Senator Alice Mary Higgins, independent politician in our Oireachtas, our Irish Parliament. And from Winnie Byanyima, Director of UNAIDS, and last but not least, Dr. Mike Ryan, Executive Director of WHO Health Emergencies Programme. What a lineup. So just to kick us off, I might come over to you, Mustaqeem, if I may. Mustaqeem is one of the sponsors of the TRIP waiver proposal, and he's going to explain in some more detail about the TRIPS waiver, which is an important tool to enable countries around the world to increase their supply of vaccines to their citizens. So over to you, Mustaqeem. You're welcome.
Nadine, thanks very much. And Jim, let me express my gratitude to the invitation to address this very August meeting. Also, congratulations on establishing this alliance. I think global solidarity can only win if we all take positions that no one is safe until everyone is safe. And so in this context, South Africa and India brought a proposal to the World Trade Organization on the 2nd of October, which is almost 8 months ago. And we are still busy negotiating. As I looked at the COVID tracker on the World Health Organization website, I see that we are ticking closer to 4 million lives. And I join you from Pretoria, South Africa, where we are in the midst of a third wave, where we are seeing an incredible loss of life due to new variants. And so from that perspective, it's in all of our interest if we can pass this waiver. And what does the waiver do? Very quickly, the waiver requires the waiving of IP rights that will enable further collaboration between producers all over the world. We've seen that a limited number of producers have promised last year to produce a number of vaccines, and they've fallen short by 97%. This year, the projected production is around 11 to 14 billion doses. As of this month, we see that just over 2 billion doses have been delivered. And this is really a far cry from where we should be. The argument that South Africa and India really makes is put lives before profits and hold companies accountable. Governments should step up. And this is the message addressed to the Irish government, message addressed to all European governments, governments around the world. Step up and take responsibility for public international health. Do not outsource this responsibility to private companies. We have international instruments that hold states accountable for delivering express outcomes for public health and international safety. And so from this perspective, it is incredible to see that since the onset of the pandemic, we've heard many states saying, well, international health and access to vaccines is a public good. But this has not been followed by concrete actions. We've heard many governments in the North making pledges and promising that vaccines will be delivered. Up to this point, we see that international mechanisms such as COVAX have delivered very few of the 2 billion doses that were promised by the end of the year. And so from that perspective, as South Africa, India, and the co-sponsors of the TRIPS waiver, now co-sponsored by 64 members and supported by 100 members of the WTO, we call on governments to join this effort to pass the waiver, to increase production in the short term and ensure that everyone has access to life-saving means. Just to also clarify that the waiver goes beyond patents. It also covers issues such as trade secrets, which are very, very particular to vaccines. So even if we pass the waiver only for patents, we would still have to deal with vaccines. And as a result, we are also calling for governments to take steps to ensure that companies disclose information that will help this global effort. I see I have 10 seconds left, so I leave it at that and I look forward to a further discussion. Thanks.
Mustaqeem, thank you so much. What a powerful opening and such a great summary of all of the issues that we all need to know more about. Thank you so much. I'm going to move over to Maho Rivas. Maho, we're going to hear from you a little bit about your own personal account of the impact of vaccine inequity, particularly on yourself here in Ireland and your family in Paraguay. So over to you, Maho.
Thank you so much. So look, I'll preface this with two things. You know, these opinions are my own, and second, I am prone to tears. So, you know, look, I own my emotions. So it was hard to condense everything I'd like to say in 4 minutes, but I will do my best. Apparently, I am a vaccine activist, but I think I'm only doing what I think most people in my shoes would do. I began speaking up about the TRIPS waiver and global access to vaccines because I was just worried about my loved ones. I'm in Cork, but most of my family lives in Paraguay. I could be here for hours telling you about the immense worry that COVID-19 is getting closer and closer to my loved ones, many of them at high risk, in a place where there is a quarter of population living in poverty, where there is no social welfare to speak of. So people have to go out and work, whether, you know, it doesn't matter if they're feeling sick, they chance infecting themselves and others, or risk hunger because there is no support there. In a place where there are no ICU beds left, there are no hospitals beds left, oxygen nowhere to be found. Telling you the stories, like I could be here for hours telling you the stories of the lives that were lost, you know, an uncle, a neighbor, a nurse, but we only have 4 minutes. And I guess this isn't about me or my loved ones, who in the scheme of things are quite privileged. And while a few days ago, Paraguay recorded the world's highest daily proportion of COVID-19 deaths, this isn't just about Paraguay either. In the news, we all saw the funeral pyres in India, and we can see the overwhelmed health system in Uganda, and more than 1,100 children under 10 have died of COVID-19 in Brazil, and it's likely to be a lot more when those records are corrected and as the pandemic goes on. But I think that in the constant updates of numbers of new cases and deaths, it seems to me that it can be forgotten that each of those numbers is a person. Each of those is someone's loved one, it's someone's child, it's someone's friend. Here comes the tears, I remember when Dr. Mike Ryan said in March last year that every person matters, every single person matters, and every community matters. It is quite frustrating to hear people around me talking about going back to normal, opening up, or about the very, the small luxuries that we all miss, and I'm there with you, while people in other parts of the world are losing lives and livelihoods, and there is no hope to get vaccines anytime soon. There are safe and effective vaccines, but most of them are coming to us, to people in the global north. We could have done more to increase the supply of vaccines so that there are enough vaccines for everyone everywhere, to distribute the vaccines more equitably, but why haven't we? And the urgency is that we have to do that now. And I guess, what is more important than every human life, than the life of those that are most vulnerable? And these are my questions, why are the lives of people in Paraguay, Brazil, Uganda, and India, and in many other places not as valuable as the lives that we have here in Ireland or in the EU? So to do everything, to not do everything that we can to guarantee access to vaccine to every person everywhere, I just think defies our shared humanity. When I became an Irish citizen, we were asked, to not forget our people, to not forget to bring with us our songs and our music and our stories. So here I am again. I guess I'm bringing these stories, and I'm doing the best so that my people, our people, are not forgotten. And I guess as an Irish citizen, I am here once again asking Ireland, asking my government, and asking everyone to stand for what's right, and I'm asking the people of Ireland to support this ask for the people's vaccine, so that there are enough doses for everyone everywhere. Thank you.
Maho, thank you. Thank you so much for bringing all of the people everywhere into this conversation, into not just our minds, but our hearts, and to just allow emotion for all of us to be here. This emotion that we translate into passion around this vaccine alliance. Thank you, Maho. Really grateful. Thank you. I'm going to move over to Isabel Simpson, who's going to share her experiences of the impact of the shortage of COVID-19 vaccines and treatments, and how that is the impact that's having on MSF's work around the world in the countries that Maho has mentioned, as well as her thoughts around the TRIPS waiver. So over to you, Isabel. You're still muted, Isabel. There you go.
Okay. Thank you so much, Nadine. And I'd like to commend the Alliance for organising this very important event today. Throughout the pandemic, Médecins Sans Frontières has assisted people in countries where healthcare systems were already under severe strain before the arrival of COVID-19. Our proximity to those who we assist drives us to speak out, and MSF has been calling for equitable access and distribution of vaccines, medical tools and treatments as a vital component in ending this pandemic for everyone. But the reality is shamefully inequitable and unfair. Let me be clear, the situation could not be more critical. Right now, MSF teams are responding to emergency COVID scenarios in countries where a lack of access to vaccines, tests and treatments are having a devastating effect on the communities we assist. In Peru, a country recently with the highest global COVID mortality rate, our teams have scaled up the response. There is a major gap in access to vaccines. Health workers are struggling with multiple variants and insufficient testing. Intensive care units are overwhelmed. Hospital beds have reached 100% capacity, and a dangerous lack of oxygen exacerbates the suffering. In Africa, we've seen a third wave of infections moving at an alarming and record rate, with just 1.2% of the population fully vaccinated. In Yemen, where we're in the 7th year of conflict, only 10 to 20% of health centres are fully functional. There are shortages of medical supplies and treatments to alleviate severe symptoms, and insufficient trained staff to operate the very few ventilators present in the country. These are but a few examples from our work. So how can healthcare systems like these respond to COVID when they have been unable to compete in the scramble and bidding war for vaccines and medical tools? Back in this part of the world, vaccination rollouts gather pace and citizens are more protected than ever from the virus and its new variants. But until vaccines are accessible globally, no one will ever be fully protected. We urgently call on governments to take practical and necessary steps to make vaccines accessible to everyone by supporting the TRIPS waiver to compel industry to share their knowledge and make vaccines available for all. If the Irish government is serious about supporting people who urgently need global help, including communities it has already committed to assisting through its overseas aid programme, then Ireland will lend its support to the temporary TRIPS waiver proposed by South Africa and India at the World Trade Organization. Ireland should use its place in Europe to influence negotiations in support of the waiver and join the growing list of countries who have already voiced their support. Arguments by some leaders, states and industry against the waiver do not stand up, and the stance taken by some is deeply disappointing. For example, a recent EU counter initiative has been proposed, which appears to be a disingenuous attempt at derailing the waiver proposal. The initiative does not address the faults of the current licensing mechanism. It undermines existing TRIPS flexibilities, and it risks delaying the urgent adoption of the TRIPS waiver proposal. And time is running out. At some point, COVAX has been best placed for rich countries to try to meet the vaccine needs of poorer countries. This reliance is at best naively hopeful and at worst a dangerously unacceptable position to take. We call on Ireland to definitively support equitable access to vaccines and treatments through supporting the TRIPS waiver and using its privileged position in Europe to influence other countries to do the same. Anything short of that will not be enough. Thank you very much.
Thank you, Isabel. Really powerful words. Thank you. I'm going to move over to Dr. Ciara Conlan, and we really want to hear, Ciara, as a doctor, you can explain to us why it's important to you as a health professional to support vaccine equity. And in Ciara's work in Access to Medicines Ireland, she's no stranger as to why the current approaches by governments and pharmaceutical companies in this area just don't go far enough. So over to you, Ciara.
Thank you so much for having me to speak today. I just want to start by saying a couple of years ago, I would have never expected or wanted to add vaccinated against a viral pandemic to my ever-growing list of privileges as a white European healthcare worker. I'm so angered by the current global inequality in vaccines distribution. As most recently, the Black Lives Matter global movement has shown us and reminded us it's important to not only acknowledge our privilege, but to stand together to fight in structural racism and inequality. I'm so grateful for all these amazing activists who are speaking here today. And I've been asked to speak about why this issue is so important to me as a healthcare worker. Thinking back to last year when I was working on the COVID-19 wards, and it turns out there was worse to come after this, but I'll never forget the loneliness and the fear the patients were feeling in isolation, unable to see their loved ones. So many of them lost their lives. This, of course, impacted on me personally, and I often felt very sad and helpless in caring for these patients. I was also afraid of passing COVID-19 to my own family. For me, the vaccine was always a hope, the only way of getting back to the normal care of our patients. Unfortunately, for so many of my colleagues across the world, they're still feeling helpless against wave after wave of severe infections, with no vaccines in sight to mitigate the numbers. I can imagine the exhaustion and burnout that they're feeling right now, and my heart goes out to them. As healthcare workers, we're used to thinking about the bigger picture. For example, we're careful to use antibiotics only in appropriate cases. This is an important part of antimicrobial stewardship. Conversely, the restriction of a vaccine makes absolutely no sense. Your vaccine works better when your neighbor is vaccinated too, and at its best when most people are vaccinated. It's no surprise that variants have been more likely to emerge in areas of high transmission. These variants may be resistant to vaccines. Vaccine nationalism and hoarding are completely self-defeating policies. We as healthcare workers and humans need to use our voices to be better stewards of these vaccines. And that means vaccinating the world, and that's how we'll end the pandemic. The current scarcity is artificial and avoidable. The holders of the rights to make vaccines have said, leave it to us. But the voluntary technology transfers thus far have been grossly inadequate to deal with the demand, and donations have fallen well short of even the most modest targets. COVAX has been hampered by supply shortages due to the monopolies of vaccine makers. We need to address the root causes of this inequality. Two of the major initiatives to increase global vaccine production have yet to be supported by the Irish government. The technology sharing platform CTAP was unanimously endorsed by the Joint Oireachtas Committee on Foreign Affairs in February, but is still yet to be formally endorsed by the Irish government. The second initiative is the TRIPS waiver, which is gaining momentum. It's supported by over 100 countries and the World Health Organization. These countries are not asking for charity, but for the right to manufacture and deliver their own vaccines. Ireland has deep development ties with countries who co-sponsor and support the waiver, including all 9 of Irish Aid's partner countries. We should listen to them and stand with them on this issue. If we truly mean it when we say we do not want to leave anyone behind, then at the very least as a nation, we should join the CTAP and support the TRIPS waiver immediately. And to borrow a favourite quote of our President Michael D. Higgins, Ní neart go cúir le chéile, there's no strength without unity. Thank you.
Thank you, Ciara. We're really all listening so carefully, and thank you for those words. Very powerful. I'd like to move now to Senator Alice Mary Higgins, and Senator Higgins is going to outline what the Irish government's response to calls for vaccine equity has been, and what the Irish Parliament and government needs to do to advance vaccine equity, and also what supporters of the People's Vaccine Alliance Ireland campaign can actually do to put pressure on the government to change this stance. So over to you, Senator Higgins. You're very welcome.
Thank you very much, and really happy to be part of this. I think one of the things we've seen a number of ministers in the last week or two coming out talking about is the race between vaccination and the variants. They're like, we're in a race between vaccines and the variants, and they're talking about their national rollout. But the key thing is that is a global race. And if we are serious about it, Ireland needs to take sides and be clear that they are in favor of vaccination. And that is the kind of a key test for us, both in a moral sense in terms of Ireland and its role in the world, but it's also, I think, a key issue of practicality. And others have spoken about the fact that variants will develop. But in terms of the consequences, it's not just that variants are developing, but also our shared global front line in terms of the health services of the world are under incredible pressure due to this virus. And the deaths that we will see will not all be deaths of COVID, they will be deaths caused by the depletion of health services, by frontline health workers who are dying around the world. So that's kind of the context of that urgency. And in Ireland, there's been some very strong measures and steps forward that have then, and then steps backwards. The Joint Oireachtas Committee on Foreign Affairs came forward with a very strong opinion in favor of an intellectual property waiver, and they cited in particular the use of the TRIPS waiver in relation to the AIDS pandemic, to the AIDS and HIV in the past. They've called for that. I had an engagement with Minister Troy, who's the junior minister, and he, responding to me back in March, said, we need a fair and equitable distribution of vaccines across the world. The government must stand up and ensure that happens. But unfortunately, that kind of moment of stepping forward was followed by a retreat back into what are inadequate political solutions. So the solutions that have been put forward by Europe only, and again, it's really important to remember, even the United States has in fact now said it will support a TRIPS waiver. So it really is the European Commission, and which Ireland has a strong influence on, that is in the way. But the arguments have been put forward in terms of charitable alternatives. It's really clear they're not adequate, because it is a matter of, there's a difference between a politics of principle and a politics of patronage. And it should not be a situation where countries are relying on their relationship with a wealthy country to possibly access vaccines. And also, of course, while COVAX is really important, the other initiative of the World Health Organization, the CTAP, the COVID Technology Access Pool, is absolutely crucial, because it sets out the mechanisms for the sharing, not just of patents and licensing, but the sharing of technological know-how, of the manufacturing information that is needed. The arguments in terms from the government haven't stood up. I don't need to disprove them. The Lancet, which is probably the most respected medical journal in the world, has been very clear that we can and should have a scaling up of global manufacturing access, and it is an artificial scarcity and a choice. It is an economic choice and in no ways a health choice. The other piece I would say is the partnerships that Europe is now talking about with a few particular companies in a few different parts of the world is also not adequate, because that is really trying not to protect people, but to protect the profit dynamic and the private profit mechanism within vaccine access. So I don't have my time monitored.
You have one more minute. One more minute. Thanks.
Okay, perfect. So what I think is now we are at a crucial point. Ireland, we've seen, is there a new Pfizer factory opening up in Cork? There's a kind of a backpedaling, and it needs to be really, really clear. A charitable solution is not enough. Patronage is not enough. We either are in favor of an international politics of principle, and I note that global access to vaccines and research and development of vaccines are in the Sustainable Development Goals. Under the Sustainable Development Goal on health and well-being, there is an encouragement and a mandate to use maximum flexibility to ensure access to medicines. So Ireland needs to decide, is it going to position itself on the side of vaccination, or is it going to simply position itself on what will be the side of maximizing profit for a very small number of companies, some of whom may be located in Ireland? Is that going to be the priority? And I would just say this test, it has consequences, of course, in lives. It has consequences immediately. But if we fail this test, we also send a signal that we cannot be trusted in respect of the climate crisis. Because the CTAP mechanism, which is one of the 2 pillars I know of, as well as the TRIPS waiver of this campaign, that mechanism of the pooling of common solutions for the public good is the same kind of approach we're going to need on climate change.
Yes.
So thank you very much, and I look forward to further discussion.
Thank you, Senator Higgins, and for making that link to climate change, just looking into the future. Thank you so much for that. Just to let everybody know, thank you. We are trending #1 on Twitter in Ireland at the moment, People's Alliance. So keep tweeting. And if you joined us late, don't forget to actually join, sign up. The link will be in the chat. Sign up and sign the petition. I'd love to come over, moving from Ireland and our perspective here, looking abroad to Dr. Mike Ryan, who needs no introduction. Mike has been leading the global response to COVID with WHO, and we're really keen to hear from you, Mike, your views on the TRIPS waiver, as well as any progress and updates as a result of the recent G7 summit around the ACT Accelerator, and particularly how you think Ireland can help from where you're sitting. So over to you, Mike, and you're so welcome.
Great, thanks. And it was fascinating listening to the previous speakers, and they're all very much aligned with with all of their views, and particularly empathetic towards Maya's views. There are so many people who live in diaspora and have spent the last year and a half worrying about their relatives back home. I've done the same, and the sense of lacking the power to affect or change or help, the helplessness is an extra stress to everyone who lives in our global diaspora. The pandemic, let me be plain and honest, half the world thinks this pandemic is over, and half the world is about to go over another cliff edge. We essentially are in a situation where if you're living in a high-income country, there are 80 vaccines out there for every 100 people. If you live in a low-income country, that number is 1.3. I don't think I need to say more. We've distributed over 3 billion doses of vaccine around the world collectively. The COVAX mechanism has only been able to secure 100 million of those and ship them to 135 participating countries and economies. The challenge we face is, and in one sense, the vaccine inequity is horrific, but there's also deeper, broader inequities. The reality is that our health systems have come under huge pressure. Why have they come under pressure? Because those systems have been poorly invested in for years. They've been deeply inequitous. We have huge issues with health workforce, huge issues with health technology, huge issues with fairness and distribution of technology around the world for years and years. We've seen it with HIV. We've seen it in so many other areas. An increasingly privatized, under-resourced, under-equipped, increasingly tertiary-oriented system that does not focus on the needs of communities, does not focus on health prevention, does not focus on health promotion, does not focus on marginalized people, and does not focus on addressing the real needs in our societies. You get what you pay for. We've got what we've paid for globally. An inequitous health system that under-delivers at times of a crisis, that is incapable of surging and being flexible and being responsive to the needs of people. We got it. We got what we paid for. And now we double down on that by having one of the fastest developments of scientific solutions in history. We've applied the learnings of the last 50 years in biotechnology, and we've developed vaccines and that are highly effective at preventing hospitalization and deaths. And what's our next move is to distribute them in an equitable fashion, so that we can stop the tragedy of the pandemic in some countries, and we will allow that pandemic to continue in so many others. It's a tragedy, and it is an abomination today that there are frontline health workers going to work in COVID wards in many, many countries who have still not been vaccinated against COVID-19. That's a disgrace. There is enough vaccine in the world to protect those who need to be protected. And remember in this, when we talk about lockdowns and we talk about all the disruption, why is our system disrupted? Our system is disrupted because governments have had to shut down economies. They've had to shut down the mobility of people, which has shut down social and economic life. Why have they done that? They've done that to protect the health system, which was becoming overwhelmed with hospitalized people, people dying, the system being stretched to the point of collapse. Vaccines avoid that reality by ensuring that the most vulnerable, older people, people with underlying conditions, and frontline health workers would get vaccinated, which would take that consequence out of the equation and allow economies to open back up again with the continued application of public health and social measures, but not at the level of swinging lockdowns that remove people's freedoms, that remove people's rights and need to earn a living. But what we've done with that precious intervention that could have done that job for everybody around the world and for every economy and for every community is we've allowed that to be distributed unfairly in a way that has delivered that solution for the high-income countries and has consigned low-income countries to what we see, the point of impact of the pandemic shifting every week. And you've seen the images. We've seen the overwhelmed hospitals, the scramble for oxygen, the absence, the lack of diagnostic tests, the funeral pyres, as one speaker said before. That outcome is not a consequence of the virus. It is in the sense that the virus is causing that disease. But that consequence is because of our inaction on distributing a vital strategic tool that will and can prevent that for so many people around the world. We have been brought to our knees by a health crisis, not by a conflict, not by a war, not by an economic bubble, not by bankers. We've been brought to our knees by a virus. And why? Not because the virus is smart, is because we're stupid. We have not been able to use a groundbreaking tool in the smartest way we could have. Now, the one good thing about humans is we learn. So without recrimination, without looking to the past, in respecting the fact that every government and has a sovereign and solemn duty to protect its own population. That's why they're elected. They have a right and a duty to do that. But surely we can do both. Surely we can take care of our own and help others, because it helps us back. And if we could move forward and find a way to accelerate the distribution of vaccines, accelerate the production of vaccines, accelerate the transfer of IP, we're not making a whole lot of progress. IP transfer and tech transfer is going to take some time. There are issues there. There are political issues. There are tech transfer issues. There's all kinds of industrial issues there. They will be worked out and they need to be worked out. But what we need now is vaccine donations. What we need is money within the COVAX system to buy vaccines, and we need countries to donate at least some of their vaccine so that the most vulnerable and frontline health workers in all countries can be vaccinated. Surely we can do both things. I thank the Irish government. Irish aid, Irish NGOs have been absolutely vital, not only in the fight against COVID, but in the fight against so many other scourges we have in the world. The Irish government has always been a leader in this field. And the Irish government has a leadership role in the European Union, has a leadership role in the UN Security Council. Leaders like Micheál Martin are vastly experienced in working in international affairs. I am sure that Ireland is and should and will work in this space, because it is time for leadership. It is time for countries to make a choice. It is time for countries to step forward and say, we can do both of these things. We can protect our own and we can reach out and protect others. It is a basic principle of solidarity. It is a basic principle of human rights. And I hope that this meeting will help to advance that discussion in Ireland and internationally. It is tough. There are so many people working so hard around the world. So many people want to do the right thing, but also citizens need to give permission to governments. Citizens need to say to their politicians, it's okay to share. It's okay. We give you permission. Thank you.
Thank you, Mike. It's okay to share. I'm just really hoping that we're learning quickly and faster and faster as we go on. Mike, thank you so much. I want to move to Winnie, please, if I can. Winnie, we have so many lessons to learn from HIV. We've heard it over and over again during this pandemic, particularly around the access to medicines movement. What can you share with us around what have we learned from HIV? And particularly with where we're at right now with access to COVID vaccines.
Thank you. My friend Jim Clark and Oxfam friends, allies in the People's Vaccine Alliance of Ireland, I'm so delighted to be with you today. I'm also delighted to be on the same panel with my colleague, Mike Ryan. It's hard to follow him because I agree with him on every point he's made. This alliance you have created in Ireland, we need it. This is the moment. It's a critical moment. COVID-19, as you've heard, continues to ravage many parts of the world. In Africa, where I come from, it is resurging. There was an increase of 15% on the number of new cases in Africa last week. Globally, it's 3%. For the same period, deaths increased by 23% in Africa, while it is reducing globally. In my own country, Uganda, I heard Mayo talk about her country, Paraguay, and mention Uganda too. Yes, people are dying every hour. Hospitals have run out of oxygen, no beds, intensive care units are full. Vaccine, the small amounts are nearly finished. It's really, really, I think the words that Mark used are right. It's a tragedy. It's an abomination that health workers are dropping off and dying because they are not vaccinated. It's a disgrace. Those words are not even strong enough to describe the scandal that we have today, that people are dying. A vaccine could be available. All these deaths are avoidable because more vaccines could be made so that everybody in every corner of the world is vaccinated. We've lost family members, we've lost AIDS activists who survived HIV and have lived with it for so many years are now dying of COVID. We've lost scientists. Just last week alone in my country, I know a pediatrician, an ENT surgeon, a gynecologist, and another specialist, all people I know, sons of friends of mine who died. Young talent, much needed talent. We've lost political leaders, religious leaders. It's just every 30 minutes, a healthcare worker dies from COVID globally. That's a stat I picked up. So where people live and what they do, their work determines their relative risk of infection, their access to healthcare, and ultimately the outcome of the disease for them. For example, although South Africa bears 2% of the global COVID burden, its COVID-related mortality is 4% of the global share. Just like HIV, COVID exposes and worsens the deep inequalities that run between and within countries, affecting our health, our economies, our very social fabric. Yet one certainty underpins all this, as I've said, these deaths are fundamentally avoidable. But yet we see the leaders of rich countries repeating the same mistakes as they did in the AIDS response by prioritizing the profits of pharmaceutical companies over the lives of people. At the height of the HIV pandemic, 9 million lives were needlessly lost because life-saving antiretroviral therapy was out of reach for people in the global south. It took 6 years from the time antiretrovirals hit the market in the north. 6 years later, that's when the price came down for people in the south to also benefit. That's why UNAIDS is proud to be a co-founder of the People's Vaccine Alliance, alongside our friends from Oxfam. And I'm thrilled to be part of launching your alliance in Ireland. 40 years of the HIV response have given us important lessons for fighting COVID. I'm going to mention 4 very quickly. First, that a global health threat, whether it's HIV or COVID, can only be defeated with a global plan that has the highest level of ambition in the plan. You cannot solve a global pandemic through nationalist approaches. Yet 2 years into this pandemic, there's still no global plan to get the virus under control. Instead, we are seeing ugly nationalism. So we're not learning the lessons. We're at the height of HIV, the world came together behind a global response to HIV. This joint program of the UN, which I lead, coordinates a global response where all countries work together to end HIV and AIDS as a global health threat. We lack that now. Only 0.3% of COVID vaccine doses have been administered in the low-income countries. 85% of shots have been administered in high and upper middle-income countries. So second, we know from HIV that health must be a human right, not a privilege, not a commodity to sell. That can't work. And yet last year, at least 9 people from the pharma industry have become new billionaires from these vaccines. Oxfam has calculated that their total wealth could vaccinate every single person in the world's poorest countries. So here there are a few people making super profits while others die. We can't end pandemics in that way. Everyone must have access to healthcare, to the scientific tools to fight a pandemic. We can't end the pandemic like that. The People's Vaccine Alliance advocates for urgent actions to maximize global vaccine manufacturing so that the whole world comes out. Secretary General of the UN keeps saying it, that it's not over until it's over for everyone, that no one is safe until we are all safe. So the 4 things we prioritize. First, now agreeing very much with Mike Ryan that we need to share the doses which exist today. We need to spread them out. This whole idea that some countries can hoard while others are dying is not only wrong morally, but self-defeating. As we've heard, new variants are being created in those places where there are no vaccines, coming back to haunt those who've been vaccinated already. So sharing those doses is critical. Sharing technology and know-how via the WHO COVID-19 technology access pool. That pool is standing empty because no country is putting their technology there yet to share it. This pool is not a new invention. It comes from the HIV experience of the medicines patent pool. It's a way to share the technology, which is a win-win for all, a win for the innovator and a win for the world. That's still lying empty, even though we know some of the vaccines have been financed by public money, and they've allowed the companies to privatize the innovations, even though they were funded publicly and should be in this pool. The second is the third point we are advocating for is waiving the intellectual property rules related to COVID products at the WTO. Colleagues have talked about that, the TRIPS waiver. I mean, again, this is about having world trade rules that are just so unjust. We've been fighting this even before the pandemic, and now the pandemic is making it so clear that the world of neoliberalism and its rules doesn't work. It's taken public resources to find these vaccines. 100 billion of public taxpayers' money was put in, but yet the companies have privatized the products and are reaping super profits, and the world trade rules support them. These must change. And there are exceptions through this waiver that we want to see apply. But we want ultimately to change the global rules of trade. You cannot sell a life-saving health technology the way you sell a luxury good
I
like
know.
like a pint of beer in Dublin. You can't do that. Life-saving technology is different. Sorry, it's almost time for me to finish. And the other
Thank you,
one
Winnie.
is, I'll be done. The other things, the other points we advocate on is investing in enhanced manufacturing in all regions, particularly Africa. And yeah, that's it. The People's Vaccine Alliance strongly welcomed the announcement by President Biden to support the waiver. And we strongly support, of course, South Africa and India's proposal. We urge Ireland, the UK, Germany, and others to rethink their positions. The third lesson is that if you don't tackle economic and social inequalities, you don't end pandemics. I leave that there. And linked to that, my last point is that we must use this moment to build a new public health order. Investments in health, in education, and in social protection are not unaffordable. They are affordable if we structure our tax systems and global taxation such that money is collected from those with the broadest shoulders to pay for them. So we must think the global health system and find ways to finance it for everybody. Thank you so much. Pleased to be with you and congratulations on this launch.
Thank you, Winnie. Thank you so much for that. And one thing I'm taking away is we do not have 6 years to wait to sort this out like we did for HIV. So thank you for that very strong message. We're absolutely delighted to be joined by so many people today, including Senator Ruan and TD Darren O'Rourke and many journalists, international and local, and thank you for your support for that. There's a number of questions. We won't have time for many coming into the chat. Panelists might be able to respond if you look at those questions. There is a question about vaccine hesitancy. What do we do about vaccine hesitancy? Fake news that's really populating countries like South Africa, Zimbabwe at the moment. And there's also a question there for you, Mustaqeem, around the recent informal and formal meetings of the TRIPS Council where little progress has been made. And it looks like the European Union seems not to be moving from its counter proposal. Are you optimistic with the meeting that's coming up at the end of July that position could be moved? So really just open to you, Mustaqeem, and anyone else if you'd like to come back on the vaccine hesitancy. Mustaqeem.
Yes, thanks, Nadine. I think on the question of the negotiations, I lead these negotiations, and I think in the last 3.5 weeks, we have made quite a lot of progress. And so what we've been very clear about has been the fact that we welcome all proposals. So the European Union proposal does not shed any further light on what we know about compulsory licenses. In fact, it tries to roll back the understanding that the Doha Declaration on TRIPS and Public Health sought to establish. And so from that perspective, we've engaged with the EU to ensure that these confusing messages are not taken up as fact. But looking at our waiver proposal, we have entered into text-based discussion. And I think as been pointed out, the media has reported that there has been little or no progress. This is not correct. Sitting in the meeting, I can see definitive areas where countries are finding each other. And I think the process is designed to draw out factual analysis and to try to clarify areas that we think are difficult for many countries to address their public health issues and concerns. And so given this discussion that we are having, I believe that there's a good basis for us to put a positive step forward. Good. And to ensure that whatever decision we arrive at by the 27th and the 28th of July is fully informed. And so my very short answer to these queries would be that we have made a tremendous amount of progress. When we started this discussion, countries in the room were denying that we even have a problem. Right. At least now we have a common objective to address and defeat COVID-19, albeit from a different starting point. We are trying to find some common areas where we think we can progress.
Yes.
And certainly we believe that the next few weeks will be critical to try to push that consensus. Every day that we lose in these negotiations means that we are losing lives.
Right.
And so ultimately, if we wanted to save lives, we need to conclude as soon as possible.
Thank you, Mustaqeem. Thank you for that. I'd like to come over to Jim, if I may, just to hear any comments and some of the comments that you might have back to panelists, and then see if we have any time just to go back. So over to you, Jim.
Thanks, Nadine. Well, look, it's been an extremely rich conversation, and you know, it's very hard to give a reflection in a couple of minutes on everything that we've heard. I suppose, you know, it was so powerful to hear the very human impact. You know, we all know about the human impact, but to hear it from a human person talking about their own situation, their own family, and more broadly their own country, and then reflecting on all the countries across the world that are particularly vulnerable right now, and to remember that we're talking about real lives of real people who we need to protect. And I think the very strong message about the impact on health systems, already weak health systems, that this has caused and is causing and will continue to cause. And I suppose the sense that, you know, what this has done is it has exacerbated existing inequalities. It has shown that there has been a lack of investment in public health services across the world. It has shown that, you know, the damage that can be caused when we privatize, or when we don't focus on doing the right things and in the right way, and the knock-on impact of that for everyone, and then I think the important lessons that are there from what the world has done in relation to HIV and AIDS, the mistakes that were made in the early years and how we resolve those. You know, for me, there's a very clear map here as to how we can really get ahead of this. And we need to know that governments are listening to this, and we need to know our own government is listening to this. So in the short term, certainly, absolutely supporting COVAX and pushing on CTAP as much as possible. But we also know that this will not be resolved until everybody is vaccinated. And the best way to get everybody vaccinated is to produce vaccines at a pace. There's we hear the counter arguments trotted out all the time about, which to me are quite offensive, that, you know, companies in other parts of the world don't have the capacity. That's just simply not true. There've been 144 companies identified across 35 countries that have the capacity and the willingness and the ability to produce vaccines right now if they had the technical know-how. Ireland is standing as a blocker. It appears to have, you know, some form of self-interest or some form of concern about its commercial you know, issues here. But I mean, we cannot allow profit to get in the way of serving the people across the world. And to remember that unless we resolve this, and this has been, you know, has come very strongly across the day, that new variants will continue to rise and they will continue to damage the progress that's been made. We have to be very proud of the progress that's been made, the scientific know-how, the healthcare sacrifices that have been made and have been articulated so clearly here, the personal impact that has on people, the thousands of healthcare workers that are dying across the world. It's disgraceful and unacceptable. And we owe it to them, and we owe it to those, particularly in the global south, to get vaccines into arms as fast as possible. And the best way to do that is to drive through the TRIPS waiver, get vaccines made in the kind of vast quantities that are required, get them done as fast as possible and out. And, you know, for our own government and the EU to get out of the way, for want of a better way of putting it, and supporting what we know will be a solution. We've a long way to go in this, but we're making it much longer. We could really speed this up. We could really make a transformative difference if we can get the support that's needed for this.
Thank you, Jim. So everybody listening today, you know, making a transformative difference. This is a small step that we can all take. So please join today, get on there, sign the petition, and join the People's Vaccine Ireland in the Alliance in any way that you can. And none of us are safe until we are all safe. we cannot say that enough times. We want to thank every one of our speakers. It's been absolutely incredible and inspiring, and I know everybody listening will be filled with passion and just that want to share it with others, which is another small step that each of us can take. So please, thank you to everybody for joining. Please get involved, get active, and take some of these messages into whatever spaces you can. And thank you each and every one of our speakers. And we're really, really grateful for all of the perspectives that you brought here today. Thank you to all our panelists and everybody who organized this event. Thank you, everybody.
Goodbye.
Bye, everybody. Thank you so much.